Treatment Action Campaign National Chairperson Sibongile Tshabalala joins us now for more on this. A very good evening to Ms. Tshabalala. Thank you so much for speaking to us. I'd like to talk briefly about this fifth National Strategic Plan 2023 to 2028 that was launched. What are the significant changes? How much is it a departure from the previous plan? What is it building on?
Remember, now we are building on the community services, because we really thought when we were writing this strategic plan to say we've been saying we are not going to leave anyone behind. So now in this strategic plan, if you read it, it will focus more on community work. We will drag community along with us. We will try to reach key populations, all of them, and also work together with them. So we are really excited, because community, that's where things are happening, that's where challenges are, that's where we need to focus. So we hope also the government and everyone will focus on community, so that we will address the challenges that we are having in the country.
So beyond being people-centered and integrating the health systems, when we talk about breaking down the barriers to achieving HIV, TB and STI solutions, can you talk to us about the importance of this three-pronged approach for many people who don't understand the relationship? Please explain that to us.
Yes, it's important that people understand that there is a relationship between TB, STIs, and HIV. We remember, when you are HIV positive, your immune system is compromised, and now it's easier for you to be infected with opportunistic infections, which TB is one of those opportunistic infections that kills mostly people living with HIV. Out of 68,000 people dying yearly of HIV, 38,000 of TB, I mean to say 38,000 of them are people living with HIV. So you can relate the number of people that are being dying because of TB, especially those who are living with HIV. That is why it's difficult to separate HIV from TB. And also, when you talk about STIs, we know that HIV is infectious through sexual transmitted intercourse. So also, most of the time, because we don't take care of our private parts, and we are having STIs, it's easy for people to have HIV, to be infected with HIV. So you cannot separate the three. That is why we continue to have this national strategic plan that talks to the three barriers, because are the number one killers and are they easily transmitting HIV.
The Deputy President speaking about the ground that's been lost almost a decade, he says, particularly during and after COVID-19. And I believe that part of this NSP, one of the focal points will be equity, and resources is one of those. Speak to us from your perspective, what you have seen in communities and why this is important.
It is important because in everything that is happening in the country, the poor healthcare system affects mostly poor people and communities on the ground. So it is important that we focus on communities, and it is important because, you know, as the deputy president has said, that we have lost a game for a while, or we have dropped the ball. So we need to pick up. But we as activists, we don't believe that it is because of COVID-19. It's just that COVID-19 got us when we were not ready. We've been saying this prior COVID-19. If I remember very well, around 2012, 2013, we've been telling our government to say we have a crisis in the public healthcare system, but they never took us seriously until COVID exposed us. What we need to do. We need to implement the plans that we have. For instance, we have a TB recovery plan that was adopted by DD Mabuza when he was still the deputy president. And that recovery plan, we work together as civil society and government to make sure that we have that plan in place. And one of the things that we are talking about and that needs to happen is the screening of people when they enter health facilities, like we did when we were screening for COVID. And we believe that if people are screened now and again when they go to health facilities, then it will be easy for us to get more people who are infected with TB, and they'll be easily to be cured, and they'll be on treatment. And also we'll continue as activists working together with government to continue to educate communities about TB symptoms and other things. But also we need new diagnostics that are available in our public healthcare facilities. Like for instance, now we are talking about TB-LEM, which it's very easy to use. It gives you results as soon as in 2 hours. And for people who living with HIV or who are having a CD4 count of less than 200, it can easily detect TB, and a person can be put on treatment. So we can save more lives if we avail all these diagnostic tools and preventative methods like your 3HP, which needs to be initiated, especially to those who are at risk of being infected with TB.
Now, if in our pursuit of the goal of eradicating TB in particular as a public health threat by 2030, how is this year-long sexual and reproductive health rights campaign that's going to be launched by SANEC help in this goal? As you've already explained, the relationship between the three diseases, but this particular campaign, what is it going to focus on, and how will it help us achieve and claw back ground? I mean, if the deputy president is saying, just even according to the United Nations high-level meeting on TB of 2018, the goals that we committed ourselves to, that we are already even off track on those.
So the SRHR program will assist us to be able to get more people to understand why they have to protect themselves first, and also use the preventative methods that are there in terms of fighting HIV and also TB. And remember that we are always, when we talk about sexual reproductive health and right, it also talks about key populations that are there in the country, of which one of our reports from Richitse, it shows that there's a lot of stigma. They're not accessing services. But then we are also knowing that if we continue working with SANAC and the government, we manage to collaborate our action together, and we have somewhere where we can start working in terms of providing services. All the challenges that we are talking about them will be reduced, and we will find a way to say, how are we resolving these problems? So for us to end AIDS by 2030, we need to look at our systems and the healthcare system to say, how are we prioritizing the PHCs, primary healthcare, where they can be able to get services, and strengthen it so that people then don't go from one area to another area to access services. And also the issue of attitude of healthcare workers, it needs to be addressed as quick as possible so that we can be able to see some achievement in terms of fighting HIV, TB, and STIs.
Well, we thank you really for your time. National Chairperson of the Treatment Action Campaign, Sibongile Tshabalala, speaking to us about the new National Strategic Plan against tuberculosis, HIV and STI that was launched today.